Here is a question I want you to answer, honestly, before you go any further. What is sitting in your refrigerator right now? Whole milk? Skim milk? The carton you have bought out of habit for 30 years? And have you ever once wondered whether it is quietly working against your blood sugar every single morning? Because here is what should genuinely concern you. Diabetes is now the seventh leading cause of death in the United States, and 38 million Americans are currently living with it, the majority over 60. And one of the most overlooked daily variables in their blood sugar management, consumed every single morning, often multiple times a day, is sitting in plain sight in nearly every refrigerator in this country. Not as a villain, not as a miracle cure, but as one of the most consistently misunderstood variables in senior blood sugar management, capable of either spiking your glucose unnecessarily every morning or actively working as what researchers call a glucose buffer, depending entirely on which milk you choose and exactly how you drink it. My name is Dr. James Carter. For over 2 decades, I have worked exclusively with senior patients managing cardiovascular disease and metabolic conditions, including type 2 diabetes. And the connection between milk choice and blood sugar control comes up constantly, because the mechanisms involved are not just about glucose. They are directly tied to the cardiovascular consequences that make diabetes the most dangerous chronic condition facing seniors today. Heart disease is the #1 cause of death in people with diabetes. Every choice that stabilizes blood sugar simultaneously protects the arteries, the kidneys, and the heart muscle that elevated glucose damages relentlessly over years. Today, I am going to walk you through the 5 best milk choices for blood sugar, ranked from a solid, dependable option to the single most powerful approach the strongest clinical research has identified. And that #1 is not a brand. It is not exotic. It is a specific method that researchers have tested directly in people with diabetes and prediabetes, and the results are exactly why you need to stay until the end. Subscribe right now and hit the bell. Every week, I publish health information your last 3 appointments never covered. Hit the like button and drop your age in the comments right now. I read every single one, and it genuinely shapes what I cover, because what your body does with a glass of milk at 45 is not remotely what it does at 70. Before the 5 milks, let me tell you about a patient whose case made this topic impossible to treat as minor. A senior came to see me several years ago, 67 years old, loved her morning coffee with milk, watched her glucose meter climb every single time she checked it after breakfast, and could never understand why, since nothing else in her routine had changed in years. She did not need to quit dairy. She needed to understand what was actually happening in that cup. We made one change: same coffee, same routine, a different milk, used a different way. Within 2 weeks, her post-breakfast readings had flattened out significantly. Not dramatically reduced overnight, but the spike that used to leave her shaky and fatigued by mid-morning had become a gentle, manageable curve. That is the entire premise of this video. The milk aisle is not where you cure diabetes. It is where you remove one quiet daily obstacle that has been working against you for years without you ever knowing it. Here is the foundational science before we count down the 5. A landmark 2018 study from researchers at the University of Guelph and the University of Toronto, published in the Journal of Dairy Science, found that drinking milk alongside breakfast cereal significantly lowered post-meal blood sugar compared to drinking water with the same cereal, and critically, higher protein milk lowered it even further. The milk was not neutral. It was actively functioning as what researchers describe as a glucose buffer. That single finding is the foundation for everything I am about to show you. #5. Lactose-free or ultra-filtered cow's milk. The dependable starting point if you are not ready to give up dairy entirely. Here is the mechanism. Regular cow's milk contains approximately 12 grams of natural sugar, lactose, per cup. That lactose is a carbohydrate and carbohydrates move your blood sugar. Ultra-filtered milks, sold as high-protein, reduced-sugar cartons, physically filter out a portion of that lactose while concentrating the protein. You receive more of the protein that slows digestion and less of the sugar that raises glucose. Lactose-free milk works through a different mechanism. The sugar remains, but an added enzyme pre-digests it, making it significantly gentler on a senior digestive system that has become increasingly sensitive with age. The same 2018 Guelph and Toronto research confirmed that higher dairy protein content blunted the post-meal glucose rise more effectively than standard milk. And a 2019 study published in the journal Nutrients found that concentrated whey protein actually lowered HbA1c, the 3-month average blood sugar measure, in people with prediabetes. A statistically meaningful reduction from a single dietary substitution. This matters specifically for seniors because of a process called sarcopenia, the progressive muscle loss that accelerates after 60. A higher protein, lower sugar milk addresses two problems simultaneously. It feeds the muscle tissue you need to protect while easing the carbohydrate load on your blood sugar. Implementation. At your next shopping trip, select 1 carton of unsweetened, lactose-free, or high-protein ultra-filtered milk. Read the label specifically. You want sugar low and protein high. Use it exactly where you already use milk today. Number 4. Fermented dairy drinks. Plain kefir and unsweetened drinkable yogurt. The mechanism is genuinely elegant. Fermentation means live bacteria have already consumed a portion of the milk sugar before it ever reaches you. And those same bacteria, your probiotics, colonize your gut and directly influence how your body manages glucose and systemic inflammation. A fermented milk drink lands significantly softer on your blood sugar than the equivalent amount of plain milk, while simultaneously doing protective work in your digestive system. Large observational studies have repeatedly linked regular fermented dairy consumption to a measurably lower risk of developing type 2 diabetes. And a randomized controlled trial of probiotic-enriched fermented soy milk in people with type 2 diabetes, published in the Journal of Renal Nutrition, reported significant improvements in blood sugar and inflammation markers over 8 weeks compared to the non-probiotic version. This matters acutely for seniors because the diversity of beneficial gut bacteria naturally shrinks after 65, and that shift is directly linked to worse blood sugar control and higher systemic inflammation. Fermented dairy is one of the simplest daily strategies to actively feed those declining beneficial microbes. Implementation: purchase plain, unsweetened kefir or a natural drinkable yogurt. The ingredient list should be short with 0 added sugar. Have a small glass alongside a meal. The word to search for on the label is unsweetened. Flavored versions frequently contain more sugar than a can of soda. I want to pause here for one moment. Of the 2 milk strategies covered so far, have you ever specifically checked the sugar content on your milk carton? Or have you been choosing based on habit alone for years? Type "check the label" or "never looked" in the comments right now. Because that answer tells me exactly how invisible this daily variable has been in your blood sugar management. Number 3. Unsweetened almond milk. The lightest option on this list, and for some of you, the easiest immediate win. The mechanism is almost embarrassingly simple. Almond milk is mostly water with a small amount of ground almond, meaning it carries minimal carbohydrate. Unsweetened almond milk contains less than 1 gram of carbohydrate per 100 milliliters, compared to roughly 5 grams in standard cow's milk. Less sugar entering your system means less sugar requiring management. The critical word is unsweetened. Flavored and sweetened almond milk varieties can carry as much added sugar as a soft drink. Nutritional analyses consistently rank unsweetened almond milk among the lowest carbohydrate milk choices available. which is exactly why diabetes dietitians reach for it first. A 2023 systematic review published in the journal Nutrients, examining plant-based milk substitutes and blood sugar response, concluded that low-carbohydrate options like unsweetened almond milk have minimal measurable impact on glucose response. One honest caveat that matters directly for seniors: almond milk is naturally very low in protein, and after 60, as I mentioned, your protein requirements actually increase to protect against muscle loss. Almond milk is an excellent low-sugar mixer for coffee, tea, and cereal. It should not function as your primary protein source the way cows or soy milk can. Implementation: replace the milk in your coffee, tea, or breakfast cereal with an unsweetened almond version. Widely available, typically priced comparably to dairy. Number 2. Unsweetened soy milk. For most seniors with type 2 diabetes, the single best all-rounder in the entire milk category. Here is why it earns this position. Soy milk performs a rare double function. It is low in sugar, approximately 2 to 3 grams of carbohydrate per 100 milliliters, while simultaneously delivering a complete, high-quality protein typically found only in animal-derived foods. That protein slows digestion and softens the blood sugar rise, while the low carbohydrate content means there is minimal sugar available to spike in the first place. I need to be completely honest about the research here, because honesty is the entire foundation of this channel. A 2021 meta-analysis published in Nutrients, pooling data from numerous randomized trials, found that soy alone did not produce a large reliable reduction in fasting glucose or HbA1c. Soy milk is not a blood sugar miracle, but the same body of research found something genuinely significant. Soy meaningfully lowered total cholesterol and LDL, the harmful cholesterol fraction. And a separate 8-week randomized controlled trial found that soy protein improved HbA1c more effectively than dairy-based casein protein. This matters enormously because heart disease is the leading cause of death in people with diabetes. Soy milk directly protects the organ that diabetes most aggressively endangers, while providing meaningful glucose stability simultaneously. This dual benefit becomes increasingly important after 60, when rising cholesterol and progressive muscle loss become significant simultaneous concerns. Soy's combination of complete protein and cholesterol-lowering activity addresses both at once. Implementation: select an unsweetened, fortified soy milk. Fortified means calcium and vitamin B12 have been added back, which matters significantly if soy is replacing dairy in your diet. Use it anywhere you currently use cow's milk. Now, number 1. Not a brand, not an exotic ingredient. The single most powerful approach the research has identified, and the reason every milk discussed so far matters more when combined with this final strategy. Drink a glass of unsweetened high-protein milk, dairy or soy, immediately before or alongside the carbohydrate portion of your meal. Researchers call this a protein preload, and it is the closest thing to a genuinely free lever available over your own blood sugar response. Here is the mechanism, and it is genuinely elegant once you see it clearly. When protein reaches your gut slightly ahead of your carbohydrates, it triggers specific gut hormones that signal your stomach to empty more slowly and prompt your body to release insulin sooner and more efficiently than it otherwise would. The result is that the sugar from your meal trickles into your bloodstream gradually, instead of flooding it all at once. You have not removed a single carbohydrate. You have changed precisely when and how your body encounters them. Whey protein, abundant in dairy milk, is one of the most powerful natural triggers for this specific effect, and the supporting research here is the strongest of anything covered in this video. A 2014 randomized controlled trial published in the journal Nutrition gave participants a small whey protein drink before a high-carbohydrate breakfast. Peak blood sugar dropped by approximately 2.1 millimoles per liter, with average glucose over the following 3 hours, measurably lower as well, all from a modest 80-calorie preload. The same 2018 Guelph and Toronto research found an identical pattern with milk consumed at breakfast. Higher protein content produced lower post-meal glucose, and the stabilizing effect persisted even into the next meal hours later. One properly timed glass of milk working long after you finish drinking it. This matters most specifically with age. After 65, the early efficient insulin response that younger bodies rely on naturally weakens. Anything that nudges your body to release insulin on time becomes proportionally more valuable as that natural mechanism declines. Implementation. Tomorrow morning, before your highest carbohydrate meal, drink a small glass, approximately 150 to 200 milliliters, of unsweetened, high-protein milk. Ideally, the soy or ultra-filtered dairy option discussed earlier. 10 minutes ahead of your meal is ideal. Alongside the meal still provides meaningful benefit. This is precisely where the entire video connects. The best milk choices from numbers 2 and 5. The gut support from number 4. The low sugar base from number 3. All of it compounds most powerfully when applied as a preload before your carbohydrates. One critical safety note before we close. If you are currently taking insulin or any medication that lowers blood sugar, adding a consistent protein preload strategy can meaningfully improve your glucose control, which means your existing medication dose may eventually need adjustment. Implement this with your physician monitoring your numbers. Bring this specific strategy to your next appointment, rather than adjusting medication independently. Let me bring everything together simply and permanently. Number 5. Lactose-free and ultra-filtered cow's milk. More protein, less sugar. A dependable starting point. Number 4. Fermented kefir and plain yogurt. Lower sugar plus living cultures that actively support your gut. Number 3. Unsweetened almond milk. The ultra-low sugar choice for coffee and cereal. Number 2. Unsweetened soy milk. The best all-rounder, protecting your heart while steadying your sugar. And number 1, the genuine game changer, a small glass of unsweetened high-protein milk used as a preload before your carbohydrates. No milk reverses diabetes, but the choices you make at the milk aisle genuinely move the needle, and it is never too late to start, regardless of your age. 3 things in the comments before you leave: which milk you are currently drinking, and whether you have checked its sugar content before today. Which of these 5 strategies you are committing to starting first. And type Milk Challenge if you are committing to trying the protein preload strategy for the next 30 days and coming back to report your results. Share this video with every senior you know managing diabetes who has never once questioned what is sitting in their refrigerator. I am Dr. James Carter. You cannot cure diabetes from the milk aisle, but you can make it measurably easier to manage, starting with your very next glass.